this is Kat Lyons from 9 Health, and this is our weekly Facebook Live show, Health happens every Tuesday at 11, and we are here to bring you objective health information that you need. The new year has arrived, and for 2020, it's important to kick things off right. So today we're going to be talking about ways to improve your health in 2020 by looking at your health numbers you really need to know. So today we're going to be talking with Annie Caldwell, Ph.D. Assistant Professor at University of Colorado Anschutz Medical Campus. And what department are you in?
I'm in the Division of Endocrinology, Metabolism, and Diabetes.
Perfect. And we're going to be talking about the importance of knowing your health numbers and how it can really help you along your preventive health journey. So thank you so much for joining us today.
Thank you for having me.
Of course. So as we know, it really does come down to numbers. So when you go to the doctor, they give you all of these numbers and we really don't know what those mean. So can you give us a little bit of information about kind of what those are and why is it important to know your health numbers?
Sure. So all of the indices that you get when you go into the doctor and get a checkup, or you go in for your annual exam, so you get your vitals, your height and your weight and your blood pressure. And then if you have blood work done, they'll often give you your lipids and your HbA1c. And all of these things are really important because they're indicators of your disease risk. So we're talking about cardiovascular disease, stroke, diabetes, and other chronic illnesses, but they're also important because they can all improve with lifestyle modifications. So by knowing your numbers, you can also know what you might need to change about your lifestyle in order to improve them and reduce your disease risk, which can be really empowering. So it's a way to take control of your health and disease risk.
Yeah, absolutely. It's important to kind of have a foundation of where you are with your health, so you know what you need to do if you do need to improve or if you need to maintain your numbers where you're at.
Exactly, yeah. I like to use the analogy of when you put a location into your phone of where you want to go, unless you tell the application where you're starting, it can't plan a route to help you get there.
Right.
And so what you're doing by knowing where you're starting is that's the only way you can plan an effective route to reach your health goals.
Perfect. Yeah, no, that makes perfect sense. Now, having this knowledge can really empower people to maintain and improve their health. So can you give us a little bit more information about things that people can do to improve their health?
Definitely. So reducing the time that you're sedentary or sitting or lying down. I don't know if you've heard, but they call sitting the new smoking.
Yes.
I
have heard that.
You always want to increase your physical activity and exercise if possible.
Yes.
If not possible, just reducing the time or breaking up the time you spend doing sedentary things can really change the way that your metabolism and your body is working. Getting more sleep and then changing components of your diet. And that's not just what you're eating, but the pattern now we're learning is important, and when you're eating, and more importantly, when you're not eating.
Yeah.
So
Yeah.
the research is pretty clear that eating late at night is never a good idea.
Yeah. Well, with the holidays and everything, and maybe not everybody has taken to that. So also now we're in January, so we're changing gears.
Right.
So we're supposed to be heading in the right direction,
Right.
not eating late at night, getting good sleep, things like that. Perfect. So can you tell us, let's just jump right into the important numbers. So
Sure.
Tell us a little bit about the numbers that we really should be focusing on, things that we need to know when we go to the doctor. What should we be paying attention to?
Great. So often when you go into the doctor right away, they'll take your height and your weight, and those are important. And often they won't tell you. They'll just write it down and think you're better off, not telling you. But you can always ask, if they don't tell you, so that later you can go and calculate your BMI, or it'll come out on a printout. So your BMI is your body mass index, and it's a ratio of your height to weight. And if it doesn't come from your doctor on a printout, you can always go into just Google BMI calculator and find one. And it's important just as an indicator of overall health. And so a normal range for BMI is a 20 to 25.
Okay.
And then 26 to 30 is what we consider overweight, and then above 30 is the obese range. So.
Okay. Now, for the body mass index, if you are in the overweight obese area, what are a couple of things that you can do to try and reverse that, essentially?
Right. So that is move more, eat less late at night, really, are the two biggest things that you can do. And you can always change, the macronutrient composition, get very nitty-gritty, but if you want just like an easy heuristic, try to eat less, smaller portions, and move more.
Yeah, that's really important, especially if you have a desk job. So you got to make sure that you break up the day a little bit, go for a walk.
Yes.
See if you can get out of the office, walk around the office building, something like that.
Exactly.
So
take the stairs instead of the elevator.
I take the stairs every day, up and down.
Me too.
Many flights,
and
all day.
Sometimes, you get in the habit, you're like, well, I'm carrying really heavy stuff now. And then all of it, it's a very slippery slope. All of a sudden, you're never taking the stairs. You're always,
yeah. Totally. Absolutely. If you guys are just joining us, we are talking with Annie Caldwell about your health numbers. So if you have any questions, put them down in the feed, and as they come up, we'll answer them. Do you have anything right now? Okay, perfect. Let's keep going. So what are the other health numbers that we really should be paying attention to?
Great. So another one is blood pressure. So they'll do this right away anytime you go to the doctor, but you also can get a blood pressure cuff and measure it at home. And this is another one that they often won't tell you. They'll just write it into their computer. So unless you ask, you won't know what your blood pressure is. So that tells us how much pressure your blood and your circulatory system has. So it's an indicator of how hard your heart is working in order to circulate blood all across your body. And so it tells us not only how hard your heart is working, but how hard your arteries are, or how elastic they still are, and how much plaque you may have built up inside of them.
Okay, makes sense. And now I know when you go and you get your blood pressure taken, the two numbers.
Yes.
Can you explain the difference between the two numbers?
I wish I could. I'm just a Ph.D.
Okay.
Sorry,
Fair
I
enough.
actually don't know.
Fair enough. Yeah. But I mean.
So there's systolic and diastolic.
Okay, perfect.
Yeah, I should know that.
So
that is a good thing to know.
That's okay. We will put that question in the feed, and we will get an answer for you guys.
Yeah.
Okay, and then what else?
So a healthy range is a systolic of 120 or less.
Okay.
And then diastolic of 80 or less.
Okay.
So then there's also your blood sugar, which can be measured with hemoglobin A1C.
Okay.
And so that's measured in the blood. Normally, if you get a blood draw to do a lipid panel, they'll also measure HbA1c. And the nice thing about that is, rather than a one-off measure of blood glucose, which can be affected by your last meal and what you ate and how long ago it was prior to your blood being drawn, it gives a cumulative measure over the past 3 months of what your blood sugar has been.
Got it.
So, it in one way you're like, you can't lie. Oh, it's because I ate a donut right before I went to the doctor. That's why it's high.
Okay, gotcha. So, but does it have an impact? Like, let's say I have my venti vanilla latte with all of the extra sugar and all of that. Would that have an impact on my reading?
No.
Okay.
No. So that's the nice thing.
Okay.
It would if you just had your glucose measured in your blood.
Okay.
It would matter. But with the HbA1c, it shouldn't matter because it's telling you about the last 3 months.
Okay.
And so you want that number to be between 4 and 5.4%.
Okay.
And that's the normal range. And then between 5.7 and 6.4, you're in the pre-diabetic or at risk for diabetes zone.
Okay.
And that's where you really want to start making changes to your lifestyle.
Perfect.
And it will change.
Yes. So just because you get into that pre-diabetic range does not necessarily mean that you're going to develop diabetes.
Exactly.
That is the stage where you can actually do a lot of changes with your lifestyle and reverse it almost and get back into your to the normal range.
Not even almost. You can actually reverse it. All of these things are so in your control with the lifestyle choices that you make.
Yeah, so yes.
My blood pressure is always high. When I see my doctor, nerves maybe. How do I know if I really do have high blood pressure?
That's a great question and a great point. So blood pressure is affected by time of day, so it changes throughout the day, and it's really affected by your physical activity. So if you're not active and you have to walk a long time to get to your doctor's office, that can even raise your blood pressure. And then it's very affected by acute stressors or being anxious at the doctor. They have what's called white coat hypertension, where if you're around a doctor, you automatically feel nervous, or if you're nervous that your blood pressure is high, that can actually make you get an elevated reading. And so you want to measure it multiple times. And when you know you have high blood pressure is when you're getting consistent readings, when you're taking your blood pressure in a very calm, neutral setting where you don't feel anxious and at the same time of day, and preferably not after exercise.
Yeah, so you can do like the take-home blood pressure cuffs and just be calm in your home and just
by yourself.
do it by yourself.
No one else is going to see the
No
number
stress.
but you.
Exactly. So you don't have to worry about, oh my gosh, I'm going to the doctor. Everything is going to be really high. So you don't have to worry about that stress. So that's a good way to keep tabs on that.
Great question.
Perfect. Any other questions? Okay, awesome. And it looks like we have one more on here that we were going to talk about, and that's cholesterol, right? Can you tell me a little bit about that and the differences with cholesterol? I know that there's good cholesterol and bad cholesterol.
Yes.
Which one's which?
So we need cholesterol because it helps us to build our cell walls and also synthesize different hormones and vitamins. So it's necessary, and it also helps you to digest your foods. And so you'll get a total cholesterol number, which you want to be less than 200. However, what you really want is your LDL, which is your low density lipoprotein, to be lower than 100.
Okay.
And so the way that I remember this is LDL you want to be low, and HDL you want to be high.
That's a good way to remember that.
So your high density lipoprotein you actually want to be above 60 if you can.
Okay, perfect. So the LDL, the low density lipoprotein, that's the bad cholesterol.
Exactly.
And then the HDL, high density lipoprotein, that's the good cholesterol. Okay.
Right.
HDL high, LDL low.
Yeah, you want it high, LDL you want it low.
Perfect. All right. So you mentioned earlier the stress of like going to a doctor and, it might increase your blood pressure or just like, it's just anxiety inducing. So what kind of questions can somebody ask if they're nervous or unsure about the information that they're receiving from their doctor?
So I cannot stress enough the importance of asking questions. Just in general, don't be shy. Share any concerns. So if the doctor says something and maybe you hear it one way, it's great to say to your doctor, okay, am I understanding this correctly? This is what I'm hearing, because if you don't ask, they assume you just totally understood.
Right.
And doctors have a certain lingo, that they all learned in medical school. And so when you see doctors talk to each other, you're like, oh, they're actually understanding each other.
Yes, absolutely.
So don't be shy. It's the time to ask questions. Don't worry about coming across as naive or uninformed. They're there to inform you and help you understand.
Right. They're there for you to answer your questions and make sure that you have the information that you're supposed to have. So you can take that out of the doctor's office and really incorporate it into your daily stuff.
Right. And if you don't, and if you just nod your head and think, I'll Google this later, they think you understood, and Googling health things can be a big black hole.
Yeah, absolutely. And also for those who feel like really overwhelmed when they are at the doctor, what advice would you share? Should they bring like an advocate with them to the doctor so they just have like another set of ears to kind of hear everything? Yeah,
it's always nice to have another set of ears if you need it, and also a calmer brain. So our brain that kind of is good at planning and thinking through and problem solving, when we're in an unfamiliar environment or one where we feel very anxious, just doesn't even work. So if you have someone that's not in that aroused state, they can think through and process the information And, if you need to be making plans about your healthcare decisions, then a calmer brain and someone else to be doing that. You can also prepare questions ahead of time and write them down, because often you think you'll remember everything you want to know, and then you get in there and they say, is there anything else? And you just freeze.
Just like, no, I don't want to know anything else.
I just want this to be over.
Exactly.
And then you can always write down these ranges so that if you are getting test results in the lab, often now you get them online and they'll tell you the healthy range and whether or not you're inside or outside that range. But if you don't understand what the doctor tells you, don't be shy to ask follow-up questions until you really truly understand what they're saying. Otherwise, they'll assume you do understand.
You just get it. Yeah. Yeah. No, it's always important to ask questions when you are unsure about something so important like knowing your health numbers. Like, you just need to know that stuff.
Right.
Great advice. Do you have any other additional information that you would like to share with our audience today about knowing your numbers and how it is actually very vital to your preventive health journey?
Right. Well, I just want to stress again the empowering nature of knowing your numbers. Rather than being afraid of them and turning away, you will get desensitized to them. The shock and awe will go away if you weigh yourself daily and make yourself informed of these things, so that you can make choices that are more in line with your health goals, rather than driven by the fear and your kind of hedonic pleasure of eating the foods you like. We all like to do that,
Yeah, absolutely.
So
perfect. All right. Well, thank you so much for joining us today, Annie. That was very informative. Again, if you guys are just joining us, if you have any questions, we're talking about health numbers and why it's important to know and understand those numbers for your preventive health journey. If you have any questions, leave them down below. We will look through and respond to them as they come in. So I think we're going to go ahead and wrap up. Thank you guys for joining us on our Health Happens show live right here on Facebook. Tune in next Tuesday at 11 for our next health topic.